I am Dr. Reddy, a dental practitioner. I am here to show you there's another way to look at dentistry. Hi folks, this is Reddy, the holistic dentist. The topic today will be on snoring. This is a current topic of discussion amongst many husband and wives, and often present themselves for discussion at my surgery to ask me what is my opinion. I did investigate this and reflected in discussion with many couples. Some of the theories say that I need to get a better pillow. Some said I need to get a better bed. I need to raise my bed. I need to get a new mattress. And some of them said that to the extent whereby the wife said to solve the solution, or the husband says each one sleeps in his own room. But obviously this is not practical and possible in terms of harmonious relationships of husband and wives. Now let's reflect on some of the issues around snoring. My experience is that many dental practitioners make what we call mandibular advancement devices. Basically, it's about getting the mandible to go forward, and when they do that, they release the pressure from the area what we know as the oropharynx. The oropharynx is an area that goes into the lungs, and that's the area in terms of the relationship of the percentage of oxygen that's related to the patient's well-being. Now, if the patient has a cold and a flu, there's a thing called the nasopharynx, and the nasopharynx gets inflamed, that sits on the oropharynx, and that causes almost compression on two aspects in relation to the volumic pressure that affects the lungs. Now, when that happens, that the area around the passage next to what you call the larynx, the voice box, right, that tends to decrease. So that surface area becomes compressed because the oropharynx and nasopharynx, maybe both of them, as I mentioned, creates an inflammatory response, and that creates narrowing of the space in relation to the volumetric pressure of the larynx area. Then the patient has what you call is a nasal sound that often reflected as snoring. Now that is one theory about it. But there's another aspect to this, that what happens to the tongue? Because the tongue, most snoring individuals are mouth breathers. That when they breathe to the mouth, the pressure that's generated to the mouth goes high up into the palatal area, creates a high vault palatal expansive area. So what goes up must come down. So that pressure that's built up towards the palate comes down, and it tends to sort of push the tongue, the path of least resistance, that goes towards your nasopharynx and oropharynx. But it can't remain there, because otherwise the patient will suffocate. Hence the patient sleeps with the mouth open, and the tongue tends to move outwards and tend to compress the lip in a downward direction. Now, what are the other aspects in relation to this pertinent issues that is not related in terms of snoring and what are related to mouth breathing is a dietary change. Because people on a high carbohydrate diet, right, generally that affects the liver function. So the liver function produces a thing called triglycerides, and the triglycerides we know gets deposited into muscular tissue, and one of the muscular tissues get deposited into is the tongue. And the tongue is a highly muscular entity in the body, and that tends to densify the tongue. As a result of that, the tongue diameter changes and the thickness of the tongue changes. So hence that you find that the volume on the mouth increases in relation to the tongue size. So that exacerbates the pressure on the oropharynx and nasopharynx, and that affects the relationship of the surface area that's available for the larynx to function, what we know as a voice box. Hence that they have a more pronounced effects in terms of the volumetric pressure that is exerted and creates a greater sound, which we know as high frequency snoring. Now these issues in relation to circumvent this, so in what I've said so far, is definitely cannot be treated in a linear way. So it has to be treated what we know as oral systemic health, from an oral perspective, from a dental perspective, but work with the physicians, work with the general practitioners, how to restore this in health and diet, and sometimes with a dietitian or a nutritionist. I think it's important to realize that there is no one size fits all in relation to the treatment modalities. But we know that if you get the diet right, if you get the conversion from mouth to nasal breathing and ensure the nasal passage is patent, because we know that the nasal passage is the only passage in the body that has a nitric oxide. So when you breathe to the nose, the air from the outside is filtered through the nitric oxide to produce clear, pure oxygen, right? And then to create a more alert nature, and the patient is obviously more alkaline in that status of health. So we need to look at this in terms of ensuring that the nasal passages are patent, the tongue size is correct, make sure that the oropharynx and nasopharynx functions in the optimal state, and whereby you circumvent any sort of sinusitis or chronic sinusitis that affects your nasopharynx, right? So that's where we need to treat it in terms of the integrated aspect of the ear, nose and throat aspect, and how the dentist comes into play, but the dentist integrates this holistically to make an appliance or use what you call myofunctional appliance. Myo is muscle, and get the functions of the muscle in relation to the lip position, the tongue position, and ensure that through diet that the tongue size, it remains optimally in the size that's, perhaps you could say, God designed. So I think this gives you a little snippet in terms of how to approach snoring in an integrative way and not in a linear way. And we've had some success in treating husband and wives, but obviously there's another spin to it as regarding the emotional quotient of the husband and wife, and sometimes we send them for counseling and to manage the situation correctly, and also that is to have this dialogue as change in lifestyle to accomplish an important areas in modern day medicine, what we know as snoring. Thank you very much for your listening, and I think that we'll see you the next stint of discussion, whereby we integrate with and perhaps another topic called sleep apnea. Thank you.